The opioid crisis stands as one of the most devastating examples of how corporate deception, regulatory failure, and aggressive pharmaceutical marketing can converge to inflict mass harm under the guise of medical progress. At the heart of this catastrophe lies Purdue Pharma and its blockbuster drug OxyContin, a potent, time-released formulation of oxycodone. Marketed in the late 1990s as a revolutionary tool for pain management, OxyContin was promoted as effective, safe, and, crucially, minimally addictive. This claim, now known to be dangerously false, catalyzed an epidemic of prescription opioid misuse that evolved into one of the worst public health crises in modern American history. While other companies eventually joined in the profit-making frenzy, Purdue's role was foundational. It manufactured the myth, exploited regulatory loopholes, and made billions, all while downplaying mounting evidence of addiction, misuse, and death. When OxyContin was approved by the FDA in 1995, Purdue positioned it as a breakthrough in chronic pain treatment. Its key feature, a time-release coating designed to deliver oxycodone over 12 hours, was advertised as reducing the risk of addiction by eliminating euphoric spikes associated with short-acting opioids. Sales representatives were armed with talking points that emphasized this long-acting formula as less addictive, citing a single paragraph in a 1980 letter to the editor in the New England Journal of Medicine, not a peer-reviewed study, which claimed that addiction was rare in hospital patients receiving opioids. This cherry-picked claim became the cornerstone of a campaign to convince physicians that OxyContin could be safely prescribed to a much wider population, not just cancer patients or those in acute post-surgical pain, but also individuals with chronic back pain, arthritis, or other long-term conditions. The strategy worked. Purdue's marketing machine, which included hundreds of sales reps, paid physician speakers, sponsored medical education, and cultivated relationships with professional pain societies, helped normalize long-term opioid use. The company provided coupons for free samples, funded studies that framed pain as dangerously undertreated, and lobbied for the concept of pain as the fifth vital sign, which encouraged clinicians to prioritize pain relief, often through opioids. Doctors who were hesitant were targeted with persistent visits and educational material. Many came to believe that OxyContin carried a very low risk of misuse when taken as directed. But this narrative was fatally flawed. In reality, OxyContin was not inherently less addictive. Its time-release mechanism could be easily bypassed by crushing or dissolving the pill, releasing its full dose all at once and producing an intense high. By the early 2000s, abuse and overdose rates were climbing sharply in towns across the U.S., particularly in Appalachia and the Rust Belt. Reports began to surface of pill mills, doctor shopping, and a burgeoning black market. Yet Purdue continued to push its product aggressively, with sales peaking at $3 billion per year. Internal documents later revealed that the company was aware of abuse patterns early on, but chose to interpret them as a public perception issue, not a pharmacological one. In 2007, Purdue and 3 top executives pleaded guilty in federal court to criminal charges of misbranding the drug, admitting they had misled doctors, regulators, and the public about its addictive potential. They paid $634 million in fines, significant, but hardly a dent in their overall profits. Even after this, OxyContin continued to be prescribed widely, and Purdue kept its patent protections and marketing privileges intact. Meanwhile, the addiction crisis grew. As access to prescription opioids became more regulated, many users turned to cheaper alternatives like heroin and, eventually, fentanyl, a synthetic opioid up to 100 times more potent than morphine. The death toll spiraled. By the 2010s, it was clear that the U.S. was in the grip of a full-scale opioid epidemic. Millions were addicted. Tens of thousands were dying annually. Entire communities were devastated. And Purdue, while no longer alone, remained a central figure in the crisis it helped create. Lawsuits from states, counties, and individuals mounted, culminating in a landmark case that forced Purdue into bankruptcy in 2019. The Sackler family, Purdue's owners, agreed to a multi-billion-dollar settlement but retained personal wealth and avoided criminal liability, fueling public outrage. The company was restructured into a public benefit corporation, with profits earmarked for opioid addiction treatment and prevention efforts, though many critics saw this as too little, too late. The opioid crisis reveals a brutal truth about the profit-driven pharmaceutical system. When a product is immensely profitable, even glaring red flags may be ignored, rationalized, or concealed. Purdue did not operate in isolation. It was enabled by weak oversight, incentivized prescribers, and a regulatory culture that often defers to industry claims. The FDA approved OxyContin without requiring rigorous post-market safety studies and failed to act decisively even as reports of abuse surged. Medical boards, pain societies, and continuing education programs were compromised by industry funding. And patients, many of whom sought only relief, were caught in a system where trust was manipulated and suffering was monetized. What sets the opioid crisis apart from other cases of industry distortion is its scale and permanence. It wasn't merely that the truth was exaggerated, it was fundamentally inverted. A highly addictive narcotic was marketed as safe for chronic use. The fallout is still unfolding, with second- and third-generation consequences including neonatal abstinence syndrome, family disruption, lost productivity, and an overwhelmed healthcare and legal system. Even today, despite reforms, opioids remain a core part of pain management, and new synthetic opioids continue to flood the illicit market, prolonging the damage. Purdue's actions around OxyContin are now studied in law schools, medical ethics courses, and public health programs as a cautionary tale. But the lesson is broader than one drug or one company. It is a story about how the commodification of medicine, when unchecked, can blur the boundary between healing and harm, where public health is subordinated to shareholder interest and the truth becomes a casualty of the bottom line.